Hey everybody, Manatee Waifu here. I just wanted to give you kind of a little update. A few days ago, I uploaded a video to YouTube talking about where I've been and how I am pregnant during a pandemic. I wanted to give you a little bit of an update. So today is Wednesday, March 18th. I am currently almost 34 weeks pregnant. I am 33 weeks and 6 days pregnant. I'm due April 30th. I also have gestational diabetes that I'm currently able to manage by diet and exercise. So I haven't been put on insulin or anything like that. So we are still planning on having my baby shower this Saturday. My area has no confirmed cases yet, but I assume that's probably going to change pretty soon. My shower was already going to be a very small gathering anyways, so I'm not too worried. I'd be more worried if we had over 15 people saying that they were going to come. That could always change though. There could be some that decide not to come between now and then. We made a post on Facebook and we basically said that we understand if they don't feel comfortable coming. And also, of course, if they're sick, please don't come. We know that some people won't be able to come because they may have been exposed to someone who was exposed to the coronavirus. So they've decided that they're not going to come, which I definitely respect that and I appreciate it. But also, my parents have basically said, like, hey, if you don't feel comfortable coming, but you still want to give us the gift that they got, then they can get it to my mom and my mother-in-law and my dad too. So they have 3 different people they can get a hold of and basically give our gifts to them so that we can in turn get them. Also, one of my retail jobs, for those of you who don't know, I work 2 retail jobs. One of them is a women's clothing store. Another one is a hobby store, craft/hobby store. So, the clothing store has decided that starting tomorrow, they're going to be closed for 2 weeks. I think that's kind of the norm right now when it comes to retail. The other store, for some reason, they have not said anything about it yet. I expect them to do the same after this week is over. And my husband also works there. I hope he still gets paid sick leave. I don't qualify for it because I'm only part-time. We do get paid this Friday, thank God. So that'll kind of at least help a little bit. And if we're not going out and doing anything, which we normally don't anyways, because I'm pregnant and we can't really, go out and go to the bars or go out and, eat a big meal or anything because I have a very strict diet. But I mean, we might end up saving a little bit of money there also. So fortunately, that timing kind of is working out. So like I said, I don't qualify for sick leave because I'm only part-time. I don't know if whatever bill that they're talking about passing, if that's going to change that at all. So, I have an appointment with my midwife this upcoming Tuesday, and I compiled a list of questions to ask her because I was freaking out yesterday. I just don't know what this is gonna do to change the way we deliver or our hospital stay. So some of the questions that I plan on asking involve, what happens to me or my baby if I end up giving birth while I have the virus, and would I be required to have a C-section? Because I think that I had read that all of the women in China who had given birth while they were sick with the virus, I think they all delivered via C-section. But I don't know if there was a reason for that other than, I don't know if it's just safer to do that than to go through a natural birth. I'm just not sure. But I wanted to know, if my hospital stay is going to be longer anyways due to the virus. Right now, my hospital is only allowing 2 visitors for a patient's entire stay. So my first visitor, of course, is going to be my husband. The other so far is my mom. But this could change over the next 6 weeks. They may have to limit it to only one person. I've seen several hospitals do that. So like I said, I was so stressed out yesterday that I had a hard time controlling my blood sugar. Fasting and breakfast were fine, but for lunch, I must have miscounted the number of carbs because I had an 11-point spike for that. I think I also ate my snack a little too close to my lunch. So yeah, I think that might be why I tested so high, but I also spiked for supper. Now I spiked like 15 points for supper, which I'm really mad about because we had chicken sandwiches and all I wanted was a sandwich. So yeah, we had a chicken sandwich. We had like asparagus, I think, or no, it was broccoli. And it should have fit into my carbs. So I don't know if just the stress of all this is just screwing with my blood sugar. But today it was a lot better so far. I never spike 2 times in a day. I only ever spike once a day if I do spike at all. But today has been a lot better. So my fasting number was fine. My breakfast and lunch numbers have been fine. I haven't had supper yet, but we're going to be doing spinach salad tonight. So I should be fine there as well. And I've also been trying to keep my mind off of things a little bit today. So I kept myself busy I did housework. I wiped down counters and reorganized the kitchen and organized the baby's room a little bit. I also did a load of laundry and I even planted some plants. So I had these little kits that I had bought that basically it comes with the dirt, it comes with the seeds, it comes with a little pot for the plant. So I planted a cactus, lavender, and a tomato plant, and then I think a fern too. So we'll see if I actually have a green thumb. I probably don't, but I will keep you guys updated on my plants, I guess. But yeah, so keeping my mind off of the coronavirus is definitely helping, I think. So that's been beneficial to me. So like I said, we're going to do spinach salads tonight. I asked my husband to go to the store to buy stuff to make that. So spinach, he's probably going to buy fresh broccoli, chicken, if they have any, but like carrots too. And I'm also going to see if he can find any toilet paper because we have enough to last us a week, but not much longer after that. So we'll have to just see. I might have to go begging on Facebook for some of the Karens to give me my poor pregnant butt some toilet paper. But yeah, I'm thinking that I probably will have to take my leave early. And that's something that I'm going to ask my midwife as well. And it's going to financially hurt us, but I don't know if I can run the risk of catching this virus and having potential complications during surgery or even just passing it on to my baby. And it's hard to not have answers. I've gone into like the pregnancy subreddits, and all of these women are so unsure of how to handle being pregnant during a pandemic. Like, we don't know what to expect at appointments, labor, delivery. It's almost like it's uncharted territory. Like all of these things that we have been doing research for, I mean, my case, like months, it all could be completely gone out the window because of this virus. I feel like we're a demographic that's kind of ignored when it comes to what we're experiencing right now. I don't want to make it seem like we're more important. That's definitely not what I'm talking about. But I think that our experiences are very unique in this because we already have something medical going on, and now we're not sure how these two completely different medical things are going to mesh in our treatment and delivery and after the baby's here as well. I mean, yeah, you see some articles here and there. I think the UK wants all pregnant women to stay out of the public for, I think it was 12 weeks. I might be wrong on that. They've also talked about the study of the pregnant women done in China, where it was a very small study. But there really just isn't a precedent for this. And I feel like we're all being kind of left in the dark because everything is so far up in the air that we don't really know where it's going to land. Anyway, sorry. Anyway, thank you so much for watching. If you want to follow my pandemic pregnancy journey, feel free to subscribe. I'll be putting out more content over the next several weeks, both relating to pregnancy, the coronavirus, and gestational diabetes. But I also plan on doing other less serious videos because I don't want to be a Debbie Downer, because I feel like everything is so negative right now that I don't want to contribute to that negativity. Once again, this video format will not be the norm. I do plan on doing videos that are going to show my actual face at some point in the future. This style is just what's going to be easiest for me right now, especially with everything going on. I appreciate you guys being here, and I really hope that everyone's staying safe, social distancing, and taking breaks from social media. Whenever the news gets too overwhelming, please remember to take care of your mental health through all this. That's very, very important, especially when you're having to be cooped up and alone. Just make sure that you're taking care of your mental health and staying safe. So thank you to everyone, and I hope you guys have a great day. Thanks.